Hello friends, welcome to my YouTube channel N-Gurukul. Today we will discuss about the nursing process. The nursing process is a systematic problem solving approach to caring for patients, or we can say the nursing process is a goal oriented method of caring that provides a framework to nursing care. Phases. There are 5 phases in nursing process, that is assessment, diagnosis, planning, implementation and evaluation, and it involves 7 major steps. The first one is A for the assessment, that what data is collected. Then the D for the diagnosis, or we can say the what is the problem. Then O is the outcome criteria. In this was originally a part of the planning phase but has recently been added as a new step in the complete process. Then the P is for the planning, how to manage the problem. Then I is for the implement, putting plan into the action. Then the R is the rationale, it is a scientific reason of the implementation. Last is the evaluate, did the plan work? According to some theorists, this 7-step description of the nursing process is outdated and misrepresented nursing as linear and atomic. So we will see the phase of a nursing process. First is the assessing phase. That's the nursing assessment. The nurse completes a holistic nursing assessment of the needs of the individual, family, or we can say the community, regardless of the reason for the encounter. The nurse collects subjective data and objective data using a nursing framework such as majority Gordon's functional health pattern. As a model for data collection, nursing assessment provides the starting point for determining nursing diagnosis. It is vital that a recognized nursing assessment framework is used in a practice to identify the patient's problem, risk, and outcomes for enhancing health. The use of an evidence-based nursing framework such as Gordon's functional health pattern assessment should guide assessment that support nurses in determination of NANDA's nursing diagnosis. NANDA stand for the North American Nursing Diagnosis Association. For accurate determination of nursing diagnosis, a useful evidence-based assessment framework is best practice. Now we will see the methods by a client interview. We can say the methods of assessment by nursing interview, client interview, physical examination, obtaining a health history including dietary data, and last is a family history, or we can say the report. Second phase is the diagnosing phase. So nursing diagnosis represents the role the nurse's clinical judgment about actual or a potential health problem, life process occurring with the individual, family, group, or a community. The accuracy of the nursing diagnosis is validated when a nurse is able to clearly identify and link to the defining characteristics, related factor, and or risky factors found within the patient's assessment. Multiple nursing diagnoses may be made for one client. Third is a planning phase, is a nursing care plan. In agreement with the client, the nurse addresses each of the problem identified in the diagnosing phase. When there are multiple nursing diagnoses to be addressed, the nurse prioritize which diagnosis will receive the most attention first according to their severity and potential for causing more serious harm. The most common terminology for standardizing nursing diagnosis is that of the evidence-based terminology developed and refined by the Nandas International, the oldest and one of the most researched of all standardized nursing languages. For each problem, a measurable goal or outcome is set. For each goal outcome, the nurse selects nursing intervention that will help achieve the goal outcome, which are aimed at the related factors, that's the etiologies, not merely at symptoms, or we can say the defining characteristics. A common method of formulating the expected outcome is to use the evidence based nursing outcomes classification to allow for the use of standardized language which improves consistency of the terminology, definition, and outcome measures. The interventions used in the nursing interventions classification again allow for the use of standardized language which improve consistency of terminology, definition, and ability to identify nursing activities, which can also be linked to nursing overload and staffing indices. The result of these phases is a nursing care plan. Then the implementing phase. The nurse implements the nursing care plan performing the determined intervention that were selected to help meet the goal outcomes that were establishes delegated task as the monitoring of them is included here as well. And the activities as a pre-assessment of the client done before just carrying out implementation of determine if it is the relevant determine need for assistant implementation of nursing orders delegating and the supervising determines who can carry out what action. Last is the evaluating phase. The nurse evaluates the progress toward the goal outcomes identified the previous phase. If progress toward the goal is slow or if regression has occurred, the nurse must change the plan of care accordingly. Conversely, if the goal has been achieved, then the care can cease. New problem may be identified at this stage and thus the process will start all over again. Make sure to subscribe my channel. Thank you. Have a great day.